Thank you for attending our Q&A event with the Green Party candidate for Toronto St. Paul, Phil DeLuna. We want to acknowledge the land we are meeting on is traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So how this is going to go is that we will have 15 minutes for Phil to introduce himself and his platform, and then 30 minutes for a moderated Q&A. We will be giving 15 minutes at the end for any audience Q&A session, or for any audience Q&As. And if there is an audience, then if you could please submit your questions via the chat box. So just to introduce Phil a little bit, Phil is an award-winning scientist and clean technology innovator. A first-generation Filipino-Canadian, after earning his Ph.D. from the University of Toronto, Phil became the youngest ever director at the National Research Council of Canada. Phil has dedicated his career to fighting against climate change at the intersection of science, policy, and innovation. He's a Forbes 30 under 30, a Governor General Gold Medalist, a Carbon XPRIZE Finalist, and an avid Raptors fan. That's great, me too. Phil is running to bring more diversity to Parliament, more science to politics, and a more sustainable future to Toronto St. Paul's. It is with great honor that I introduce Phil DeLuna.
Thank you. Thank you so much for the introduction, and thank you for having me. It's a pleasure to be here. You already gave me the introduction. I don't have to say anything else, but maybe I'll just give a little bit of a background to myself. I came to Canada when I was 5 years old from the Philippines. I grew up in Windsor, Ontario. My father was an auto worker. My mom worked in customer service. They couldn't give me much growing up, but they could give me an education. And they always said to me that, people can take away things from you, but no one can take away what you know. And so I really took that to heart, and I knew that education would be my pathway to a better life. And so I studied really, really hard. And then I went to a lot of school. I did my undergraduate at the University of Windsor in chemistry, my master's in the University of Ottawa in chemistry, and then my PhD at the University of Toronto in materials science and engineering. My research has always been about clean technology. How can we capture carbon dioxide out of the atmosphere and then convert it into things that we need, like fuels and chemicals? The way I like to describe it is artificial photosynthesis. And so throughout my PhD, I was on the sort of track to become a professor. I was publishing in these high impact papers. And then about midway through, I had a conversation with my partner, my fiance. She's a nurse at Sick Kids. She works in the operating room, and she wanted to stay in Toronto. Her family is here, our friends are here. And I made the decision in that moment that I wanted to be with her more than I wanted to be a professor. I wanted to, stay here rather than do 2 years of postdoc somewhere and then become a professor and who knows whereville. So I then pivoted and thought of, well, why can't I take the technology that I've been working on and turn that into something? And so I founded a company that made it to the final round of the Carbon XPRIZE, which is a $20 million competition to capture and convert the most CO2. And then I came to the realization that just because you have an idea doesn't mean that it's ready for market. And I applied to this job at the National Research Council. They were looking to recruit me for a director position. And I thought, well, quite frankly, I'm not a 50-year-old white guy. There's no way I'm going to get this job. But I applied anyway. And I really only applied to put pressure on my professor to commit to the startup because he was hot and cold about it. Applied, did the interview, got the job offer, went to my professor and said, hey, Ted, I really want to start this company. I want to be the next Canadian Elon Musk. And he said, Phil, the technology is too early. Go take this job at the NRC. So I've been at the National Research Council for the last 2.5 years, working on building a new program, $57 million collaborative research program called the Materials for Clean Fuels Challenge Program, focused on disruptive technologies to decarbonize Canada, carbon dioxide conversion, hydrogen production, materials discovery using artificial intelligence. And about last year, throughout the pandemic, I came to the realization that while science and technology is important and necessary, it's not sufficient. We have the technology. We know what we need to do to address climate change. What's lacking is political will. What's lacking are the policies to get us there. And so, like many people during the pandemic, I had a moment to step back and reflect on my life and what's the impact I want to make on the world. And I was also a part of this program called Action Canada, which is a public policy accelerator program. And I met Annie Paul through that program because she's an alumni from its first ever cohort. Annie Paul being the leader of the Green Party of Canada. She was recruiting and she said, Phil, we'd love you to run. And I'd never spoken to the leader of a federal party before. I had never been politically inclined ever in my life. I never volunteered. And then I thought, well, I know what's missing, right? And the gap is the policy, the political will. Can I make an impact here? Can I use the skills that I've learned to do that? Can I bring more science to politics, more diversity to parliament, which I think is really important. And so I've been on leave without pay from the National Research Council since April to run for office. And it's been an incredible journey. We've been running an extremely modern and digital campaign. I've been focused on three main themes: green jobs that leave no one behind, housing that all can afford, and supporting our essential workers. And each of these three things are personal to me. On the green jobs piece, I mean, it's my background, it's my passion. But also, I said earlier that my dad was an auto worker in Windsor. Well, in 2008, the automotive sector collapsed and Ford closed down its plant, and my dad lost his job. And he's been bouncing around from factory job to factory job since. So I know exactly what it's like for an entire community to be dependent on one industry and what happens when that industry fades away. And so I see that exact same thing happening in today's oil and gas and heavy emission industries. And of course, addressing climate change is about making sure we have a planet to live on. But we also have to ensure that the families and the workers have a clean and green job destination for them to transition to. These are people's livelihoods we have to think about. On the housing affordability, I'm part of a generation, I think all of you are too, that are wondering, will we ever be able to afford a home in the cities that we love, in the communities that we've been raised in? Our generation is, quite frankly, looking at how housing and affordability is becoming more and more out of reach. And that's not sustainable. If the majority of our incomes are going towards housing or mortgages or rent, that means there's less money for us to save. There's less money for us to put into the local economy to stimulate the local economy. And that means that our economy in general it becomes far too concentrated on real estate and not on other things that bring value to our society. And then finally, on essential workers, I'm Filipino-Canadian. My partner is a nurse. Many Filipino-Canadians will occupy these low-paying but essential roles in healthcare, in the factories, in fulfillment centers, in agriculture. So I care deeply about ensuring a fair and equitable world where we do not forget the lessons of the pandemic and we value essential work as essential, because these are the people that kept us safe. And only when things start to break down do we realize the structure that we have around us and the people that keep that structure whole. So that's me. That was a very long introduction about my story, my background, why I'm running for office. But yeah, I think I'll pause there.
Thank you so much. That was so motivational.
Thanks.
Yeah, thank you very much for also sharing your goals as a political candidate. If you don't mind, we'd love to hear more via our Q&A that we have for you. So to start off, we'd like to start off the Q&A with the most recent and the current topic, which is the COVID-19 pandemic. So with the fourth wave of Delta variant fueled cases that are happening, how does your party, the Green Party, plan to relieve the uncertainty of sectors and subpopulation groups that are most vulnerable to COVID if cases just keep rising?
That's such a good question. And I want to address this question by first talking about what do we mean by those populations most vulnerable to COVID? And to me, at this point, it's the populations that haven't been vaccinated. Because before, when we didn't have vaccines, the populations were the elderly, were those who are immunocompromised. But now it's the populations that do not have vaccines. And so really what we're talking about here is how do we get people vaccinated to ensure that they're safe? And this is a really complex question. And it's also one that is highly politically charged, especially now. I mean, we're seeing reports of protesters who are protesting outside of hospitals, limiting services to people, life-saving services to people. And every single time I'm out on the campaign trail, every shift, I hear from people, at least one or two, who are adamantly against vaccinations or vaccine mandates. And a lot of it is around personal freedom and all these sorts of things. There's another set of populations that are maybe perhaps racialized or lower income or are skeptical of government services in general, who potentially because of a lived experience or because of language barriers, simply don't feel comfortable getting the vaccine or simply aren't able to get the vaccine. And so for me, what I think is important is that we address these populations first, and that we do that by meeting these populations where they are, by making sure that we have mobile vaccination units who also have people who speak the languages of these communities and who can communicate in these languages. It's important that we reach out to the community leaders of these languages, whether those are faith-based, actually restaurant-based. Restaurants are, and food is really where a lot of communities come together. So we have to be creative, and we have to think about ways of reaching these communities and these populations. I'm part of the Filipino community, and actually the Filipino community are some of the most vaccine hesitant. And a lot of that is because of misinformation on social media. A lot of that is on Facebook. I always have to tell my dad to stop reading what he sees on Facebook because it's not real, and then to go on to trusted sources. But he always sends me things that I think are a little bit sketchy. So a lot of it is about education when it comes to those populations. When it comes to populations who simply either refuse to get a vaccine or who believe that it's an impingement on personal freedom, that's trickier. It's a lot more difficult. And unfortunately, I don't have an answer to that. And I don't think anyone really has an answer to that. And there is something to be said about ensuring that those who have been vaccinated and our children who cannot get vaccinated are safe from those who choose to put others at harm. And I have no empathy for those who are protesting in front of hospitals right now, with my partner being a nurse at Sick Kids. It infuriates me completely. So I don't have an answer for how to deal with those populations. But I really do think for the rest, the number one thing is to get vaccinated, and we have to meet the communities where they are.
Thank you so much for that, Phil. My sister's also a nurse, so I completely share your feelings towards that. I'm going to go for the second question now, related to COVID. So the question is, what lessons do you believe we as a country have learned from the management of the previous waves of the COVID-19 pandemic? And what would your party do differently for future pandemics?
Another great question. And I think the biggest lesson that I've learned as well is that just because we have scientific advisory panels and medical experts doesn't mean that necessarily translates to the correct political action. You can listen to science, but you also need to act on it. And I think there's that missing link, which is actually having scientists in office, people who can translate to their colleagues what scientific data means, how the scientific method works, why data changes, how the evolution of science is important, and what we can do to plan around that. So to me, I think that was one of the biggest lessons. And we saw that, I'm based in Toronto. So, and of course, a lot of these are provincial jurisdictions. When we think about the reopening of Canada prematurely, in my opinion, for the third wave, and then just the mismanagement on how to reopen, the mismanagement around schools and the guidelines. And a lot of it has been around passing the buck down. For example, passing the buck down to small businesses, passing the buck down to school boards in order to deal with those measures. We need to standardize these things. It's not only at a provincial, but at a national level. And we need to really work together across parties, but also across governments to make sure that we have consistent messaging and consistent guidelines. And sure, things are different in different population centers because the nature and the demographics of those population centers are different. But the guidelines and the spirit of what we should be doing should remain the same. We're trying that absolutely. The next thing that I think we've really seen is how fragile our long-term care is. And this is why the Green Party specifically wants to radically reform our long-term care, bring it under the Health Canada Act. And this is a tremendously important situation, not only now, but going into the future. People are living longer. Our population is aging. The baby boomers are getting to a point where they will need long-term care. Many of them will need long-term care. We cannot forget the lessons of that and how ill-prepared we were and are as a nation to deal with long-term care. And so standardizing long-term care, making sure that we have the correct standards, that that personally, I would like to see privatization of long-term care go away, and most long-term care become publicly owned, because those are the ones that we saw the best outcomes for. I mean, of course, there are some private long-term care homes that did very well, but those are usually the more expensive ones. So can we think about then at least making a standard to ensure that every private long-term care facility meets that standard, and they have the correct number of personal support workers per beds and residents and all these sorts of things? That's really, really important. And then again, another thing that we saw is how fragile the hospitality industry is. Those who are working in gig work, those who are working in non-secure or very transient jobs. And actually, one of the things the Green Party is extremely passionate about supporting is a guaranteed livable income. And we saw this past year what CERB was basically a massive trial of a guaranteed livable income. And now we're having the conversation about, well, we're hearing about hospitality industries and all these sorts of things having trouble staffing people because the wages are too low. Well, is the issue because people don't want to work, or is it the issue because they're not being paid a fair wage for fair work? Right? So I think another really important thing, a lesson that we've learned from the pandemic, is we've started to think about what is the value of our time, what is the value of a life, what is the value of work. And going forward, we need to think about what those values are, and we have to appropriately price them and appropriately value them. And this is entirely about why we need to value essential work as essential.
Thank you.
Thank you very much for your elaborate answers. I think we can all agree that, COVID-19 really made us think about how we can reshape, the future and where we can improve on. So now we want to move on with questions related to healthcare. So the Green Party has openly criticized the Liberals' policy on mandatory vaccines, and they also requested more details on the government's plan. What would your party do differently, and how does it plan on dealing with Canadians who refuse a shot for religious or medical reasons?
So again, a wonderful question. And I want to be clear here, the Green Party absolutely recognizes that vaccines are our way out of this pandemic. We unequivocally urge everyone to get vaccinated. I'm double vaccinated. A lot of the folks that I know, everyone I know is double vaccinated. The criticism that the Green Party has put towards the Liberal Party on this issue is not the issue of mandatory vaccinations or the announcement of trying to promote vaccines to get through this pandemic. It's the issue of timing. It's the issue of the Liberal government announcing that they wanted to implement a mandatory vaccine program that would only begin after the election, and in my view, was done politically to create a wedge issue between the Liberal government and the Conservative government. To me, we should not be playing politics with vaccines. We should not be playing politics with people's lives. So there will 100% coverage is impossible. We know this. There exist medical conditions. Religious conditions, this has already been tested in the Supreme Court, do not hold up from a law perspective to not get vaccinated. The case that you can look into, I believe it's, I think it's a Mennonite or Jehovah's Witness case from like the 90s or something. But that has been settled. But there are existing and valid medical conditions and reasons why people won't be able to get vaccines. There is a population of children that will not, that because the vaccines haven't been approved yet and may never be approved for infants to age 5, that will not be able to get vaccinated. So the idea of getting a 100% coverage completely of vaccines is not realistic. And I think what the Green Party is really concerned about is what is the implementation of these policies. You can't just say we're going to do mandatory vaccinations and not give us an idea and the timeline of what that's going to look like, what the repercussions for that will be. Will the cost of implementing this program be passed down to small, medium enterprises and businesses? How will these things be, from a legal perspective, argued and settled in court? This is what we're concerned about. It's not the mandatory vaccines or the concept of mandatory vaccines. It's how will it be done? How will it be done equitably and fairly? And why are we talking about this now and using it as a political tool? That's the issue at hand.
Thank you for your answer. I'm going to move on to the next question. So instances of racism and stigma in healthcare have proven to worsen the access to health for Indigenous persons, refugees, and immigrants in Canada. If elected, will your party work to implement strategies to dismantle systemic discrimination in healthcare settings? And how does your party plan on ensuring quality access to healthcare for these subpopulations?
Again, fantastic question. It's a personal one too. I mean, I think we've all lived through this past year through Black Lives Matter, through the discovery of the residential school unmarked graves, through the treatment of Joyce Echaquan in Quebec at the hands of the healthcare system. When I was growing up, I remember my parents were wary of going to the hospital as well. They would, if anything could be solved with some Vicks Vapor Rub, they'd try that first, right? Or whatever remedy that they could come from home. And this is a tough one. There's the issue of this systemic racism within our institutions, but there's also the issue of culturally, how do we reach racialized groups, underserved groups, and groups that traditionally have experienced systemic racism, or maybe immigrants who've experienced systemic racism in their home countries and are now wary of the system here in Canada. I think those two, while connected, require very different and specific solutions. When it comes to systemic racism within the system, it really has to, that is really a bottom-up approach. And it starts with cultures within departments, within specific hospital settings, caregiving settings, long-term care, whatever it may be. There has to be zero tolerance for it. We have to recognize, we have to ensure that training is met. We have to make examples of people, quite frankly, who perpetuate systemic racism or explicit racism within the healthcare centers. Racism and systemic racism is very tricky because what the definition of what is racist to you may be different to this other person, to me, etc. It's very objective. And so what some person may think is racist or may feel is racist, another person may not. And so what we really need to tackle here is an understanding and a level setting of communication of how do we talk about racism? How do we talk about racism across cultural lines and across racial groups? And then from those conversations and discussions, then determine how do we move forward. Then when it comes to dismantling systemic racism in the platform, which I have here, it's a long document. So all these questions I have bookmarks and stuff, but I encourage you to go read it. There's an entire section also around systemic racism, and it's all about reducing funding of, this is more around policing, reducing funding to RCMP, reviewing how things are done to increase mental health services, and then revamping and reallocating those to the places that need it most. Well, that's not exactly the healthcare sector. It intersects with the healthcare sector because, as many people know, unfortunately, the mandates of police and law enforcement have been increasing more and more, and as a catch-all to deal with mental health, to deal with as a first responder to many of these different things. So we have to think holistically about the services that we offer, and then we have to think about how we communicate those services to racial communities and make the effort, which comes with training and with regulation and with all these sorts of things, and allocation of funding in the correct places. In order to deal with systemic racism. But, I think we're making progress. And the reason I say that is because we're having this discussion, right? Like systemic racism was not a discussion we were having 10 years ago or even before that. So the first step is having the discussion, and then we come together and think about how do we make the solutions.
Thank you very much for your answer. Yeah, I completely agree that, cultural tailoring is like a huge key to dismantling the systemic discrimination in healthcare. So yeah, I like that how you've included that in your answer for sure. So for the following question, if elected, how will your party plan on working with provinces who disagree on your plan for the universal pharmacare program? Yeah,
so we have a model for this already in many respects, right? And I think really what this question boils down to is a constitutional jurisdiction between governments, right? Between the federal government and the provincial government, and to some extent to the municipal government. And the reason why I have lots of hope for why the Green Party can do this, work across governments, even across parties, is because we are such a small party, and because we are a party that is known for being collaborative and working across the aisle. In every situation, whether it's in a provincial government or the federal government, the Green Party votes with every other party. And the reason we do that is because we believe in that better solutions and robust solutions come when you have collaboration, consensus, and work together. And so it really comes down to that. And then when it comes to how would we do it, with parties that don't necessarily agree, well, we can look into examples, it's the carrot or the stick. How do you incentivize people, and then how do you decentivize bad actions? It's a combination of both of those things, but it really starts with dialogue, and it really starts with coming at it from a place of good faith. And again, the reason why I think the Green Party is uniquely positioned in this way is because being a smaller party, being one that doesn't have as many members in parliament, being one that doesn't have a history in the partisan sphere, we don't, one of the reasons, quite frankly, I ran for the Green Party is I almost felt there was the least partisan party. And I felt that no one really hates the Green Party, and I could potentially make a bigger impact, and no one would blame, if I'm not successful, a 29-year-old clean tech person for running for the Green Party. And all of you work in the public sector, I work in the public sector. It's less of a stamp on your name, if in my view, I thought, running for the Green Party than some of the other parties and becoming more quote unquote political. So given that sense of collaboration, that sense of neutrality, I think that's where we would come from in the Green Party, to try and build those bridges across party lines and across jurisdictional lines as well.
Thank you for sharing, Bill. That answer was really good. Like, the collaboration aspect is so important, like with working in government. For your next question, Anime Paul has previously stated that the pandemic has highlighted the need for innovative social policies, one of them being for the current opioid epidemic.
Mm-hmm.
Given the urgency of the epidemic, how does your party plan on tackling it?
Yeah, again, in the platform, there's a whole section on it. We want to decriminalize the personal use of opioids and create a safe supply. Now, a big issue with hesitancy of reaching out for services, especially for those vulnerables and those struggling with addiction, is they are worried about what that would mean in terms of a criminal record and how that may impact their ability to get jobs or to get employment. And these are already vulnerable people who, for whatever reason, whether it's mental health reasons, whether it's something else, have suffered and have turned to opioids and have developed an addiction, and some unknowingly have just fallen into it. So the number one thing we can do is decriminalize the personal use of it and make it not a crime. These are people who need our help, they're not criminals. And then the second thing, of course, is introducing a safe supply. One of the biggest issues, as we all know, is people overdosing, and especially from fentanyl and carfentanil, all of these sorts of things that they're getting from China and other places that they're unsure about what the dosage is, what else is cut with it, how is that being done. So, I think if the government has a safe supply, if it works with the municipalities and the provinces to ensure safe sites, and we work together to deal with the root causes of the opioid crisis and addiction, then to me, that's a better use of money than, quite frankly, shoveling a lot of these folks into emergency healthcare systems or into the criminal justice system, which has bigger fish to fry and more important things to worry about. And unfortunately, that's the and again, it also coincides a little bit with institutional racism, which I won't get into, and all of that. So these things are holistic, and they all interact with one another.
Thank you very much for your answer. For the next question, your platform addresses a lot of major issues in Canada, such as climate change, affordable housing, and mental health. More specifically, your platform states that you would push for increased investments in the social determinants of health.
Mm-hmm.
Could you elaborate more on this point, on as to which determinants of health are the most important for us to invest in, and why?
Yeah, so there are many, and if you want to look up to the whole list of them, I think the United Nations has a list, or the World Health Organization has a list. But really, it comes to socioeconomic factors. A lot of it has to deal with actually income. A lot of the social determinants of health are regional, based on which area you grow up in, what access to healthcare and resources you have in that area, what access to food do you have in that area, healthy food. What access do you have to green space in that area? And unfortunately, what we're seeing is, and this is a lot of, it's really an urban planning issue, but of course the federal government has a role to play in helping to work with the municipalities to address that. In fact, one of the big pieces of the Green Party platform is to increase transfers directly to municipalities. Only about 10% of tax revenue goes to the municipalities from people who live within those borders, which is far lower when you consider all the services that municipalities provide. That was a bit of an aside, but really when it comes to social determinants of health, it's a human geography perspective. So it's income, it's geographical location, it's culture as well. And a lot of it has to do with generational, whether that's generational wealth, generational trauma, generational cultural biases, all of that. So I think that we do have to study this more. But I think the big piece in terms of reinvesting in the most important social determinants of health is actually in investing in our cities and our municipalities, because they're the ones who are on the ground, who are offering these services and who know about these social determinants of health very intimately. And I think it's high time that the federal government gives them their fair share.
Thank you so much for your answer. I'm so glad that you brought up geography and healthcare and how you kind of looked at the intersection between the two. I've taken so many courses that kind of emphasize that interaction, and it's so important that we look at that. In terms of our questions for our moderated session, we are done, but since we don't have any audience members right now, is it okay if we move on to like another few questions?
Absolutely, absolutely, yeah. And you know, I'm an open book. You can ask me anything, you know, whether it's on policy, which on my personal journey, whatever. One of the things I'm really passionate about is lowering the barriers of entry for underrepresented groups to get into politics. You know, one of the first things that I did when I was considering running was I Googled how to run for office in Canada, and I got like Elections Canada forms with a lot of, you know, government jargon. And there was nothing else. When you look at how to run for office in the United States, there are all of these groups that are trying to organize youth to get involved in politics and all these sorts of things. And there are vlogs and all these things, and there's nothing like that in Canada. So actually, one of the things that I've done is I've started, when I first started being a full-time candidate, I've been vlogging my political journey to try and help share my experience with other people in a medium that I think will, you know, resonate with youth. And I talk about things like, what's it like to be a candidate? How do you become a candidate? How do you raise money? What does the money go to? What is mental health like? You know, how do you determine how important a leader is in recruitment? All of these sorts of things. Anyway, I just got off on a tangent, but yeah, I'm really passionate about sharing all the knowledge that I can. So please ask away.
No, definitely. That sounds great. I'm going to ask Jacqueline or Maham in case you guys had any questions that you'd like to pose.
I do actually, and Phil, you kind of answered it a little bit just there, but I think it's fantastic. The vlogs, for example, I would definitely watch those, and I know a number of people in our organization would watch them as well. But something that you said at the beginning really resonated with me, and also in an interview I believe that you did, just talking about how a lot of the people who surrounded you in leadership positions often didn't look like you, and that sort of, I found for myself personally, has made me sort of self-select out of opportunities because I can't envision myself in those roles, or find a mentor to help me navigate that process to becoming a leader or gaining leadership positions. So I guess my question is just around what sort of helped you to make that final decision to run for office and pursue your platform. And then also what advice you have, and maybe people will have to watch your vlogs for this, but for first getting involved in politics specifically for youth and to learn more.
Yeah, those are really good questions. I'll start with the second one first, which is, how do you get involved in politics? Go volunteer for a campaign, especially for youth. It's actually a ton of fun. Like yesterday, we were street canvassing. We had a speaker with us. We were dancing to September by Earth, Wind, and Fire. We were waving signs all over the place. We had a bunch of high school students with us. There were like 25 volunteers. We canvassed 1,500 homes. It was just a fun time. A lot of people don't realize how much fun a campaign can actually be. So go out there, do it. Volunteer for multiple campaigns in different levels and different parties. See how they differ and what that's like. It's actually really exciting to get a chance to see behind the curtain on that. So my number one suggestion is to volunteer. And then the second question, or the first question I should say, which is really about mentorship. And this is I'm gonna get a little bit personal here and talk about a lot of my own identity, my own racial identity, and how that has influenced me throughout my career. And the interview that you spoke of, it's an op-ed that I wrote in the Toronto Star about a year ago. And the first line of that op-ed is, "When I was young, all I wanted to be was white." And the whole premise of that op-ed is, when I was young, I grew up in Windsor, Ontario. Most of my friends were white. I wanted to fit in. I wanted to have peanut butter and jelly sandwiches for lunch instead of adobo chicken on rice. And by the time, like, the adobo chicken on rice is delicious, but it's really good warm. And there isn't any, or at least not back then, any microwaves. So I was eating this cold chicken on rice, and it wasn't very good. So these are the type of things that, I wanted to belong. I wanted to fit in, and I kind of shunned my Filipino-ness for a very, very, very long time. It's only been recently in my life when I started, advancing in these different positions within my career, that I came to realize and notice, one, there wasn't anyone else, very few Filipinos in every stage of my life, in my career trajectory. And then two, there were starting to be other young Filipino people who would reach out to me for mentorship and help and guidance. Just reach out to me on LinkedIn or have a conversation with me after a conference. And I came to realize that, well, wait a second, while I may be the first, I'm not going to be the last. I'm not going to be the only. And that was very inspiring to me. And then when I came to realize that people were looking to me, I never thought I would be, a role model for the Filipino community in any way whatsoever. I was just doing me. But then when I realized that is actually what was happening, I started to then reassess my identity and my relationship with my racial identity. And the pandemic over the past year really helped accelerate that too. Whereas before, I was a little bit ashamed to be like, Filipino people are always thought of personal health support workers, always the nurse, never the doctor, working in custodial work, all these sort of things, which are important, essential roles. And I think it took the pandemic for a lot of people to realize how important and essential those roles are. And I came to the realization within my own racial identity that a lot of the things that make me who I am are precisely because of my Filipino identity, my respect for my family and for my elders, my hard work ethic, which many Filipino people have, my empathy and my desire to care for others. There's a reason why you see many Filipino people in nursing professions, in healthcare professions, in caregiving professions. It's because they're immensely caring people. There are lots of things that I personally, and again, this may be too much information, but like the relationship that I had with my parents, the sort of conservatism and the strict Catholicism there that I really shunned throughout growing up and being a teenager and a rebel and being like, no, mom, I want to hang out with my white friends and all this kind of stuff, that I came to realize, is part and parcel and part of a greater and more complex racial identity that I'm still learning about and I'm still evolving in. But a lot of that has shaped how I carry myself in my life, in my career. And now I've come to the position where I realize I am an example to other people, and I want to be an example to other people. One of the reasons I'm running is so that, because Filipino people are the third largest visible minority population in Canada. Year on year, they're the largest immigrant community. The largest number of immigrants are typically from the Filipino community. And this country has only ever had one member of parliament in the history of its confederation, just one. There currently is none. There was one in like the 80s. And I think that should change. I think our government and our leaders should be representative of the people that they lead. And it's a very complex situation when it comes to politics in the Filipino culture, because politics and politicians are a dirty word in Filipino culture. In Philippines, they're corrupt. People move away from Philippines to get away from the political culture there. And when I told my mom that I wanted to run for office, she said, "Phil, why are you doing this? Why are you giving up your scientific career to go run for office? They're all corrupt." And I said, "Mom, this is Canada. I want to make a difference. I want to serve my community." And I had to explain it to her. And that's the barrier that we have to face as first generation or a second generation Canadians, is explaining how the culture in Canada is different and why democratic participation is important and why voices need to be heard. So that's really another big reason why I'm running. And then to your last point, I probably wouldn't be running if it wasn't for Annie Paul. Being a racialized, the first African American or African Canadian, the first Black, Jewish, female leader of a party, that to me, that's saying, yes, we can do this. Like there is a place in these leadership positions for racialized people, and that was really inspiring to me, and I wanted to run for her, and with her, yeah. So that's the answer to that question, I think.
Thank you so much. That was fantastic. I totally relate. I remember when I was growing up, I felt like the best compliment I could get was, "Oh, you're so whitewashed," because I came from a very small white town and like only minorities. So I totally relate. And I think that the pandemic has been a good time to reflect and just realize that your diversity is actually a strength that you bring and not something that should be hidden. So thanks so much for sharing that.
Yeah, thank you
Yes.
so much. I completely resonate with that as well. I'm a first generation Pakistani Canadian. And so I completely understand like the way that you grew up is very similar to me as well. And just like me moving from like the GTA to Ottawa last year, being in the federal public service, I've noticed that there is a lack of diversity that I've seen compared to like what I've seen in the GTA. And I'd love to see like in the next 20 years how that might progress.
Absolutely. You're part of that. You're part of that progression, right? And I think that's
Hopefully.
why it takes time. It takes time. I think, I think all of us here, all of us are part of that generation that is going to be making more diversity and rising through the ranks within our institutions and within our careers. And I think that's really, really healthy and it's exciting. And one of the things that I am really excited about and really encouraged by is that I have had amazing mentors in my life, and all of them were white, right? I actually haven't felt that my racial identity was, discriminated against. And I think that it depends on the structure. It depends on who you're lucky enough to have within your organization. It depends on your bosses. It depends on your field. In science and academia, it's a very meritocratic area, and so I felt that I could, I could excel. And if I got the results, if I did the good research, if I published in the high impact papers, I would do well. There are many other sectors and many other areas where that's not the case, and where systemic discrimination is and racial discrimination is very true. And actually, unfortunately, I can say that is very true in sort of rural and urban divide. And I think that's also true a lot within our governmental institutions and large institutions in general. But it's changing. And I think that's what I'm excited about, is that there's not only is there a young generation of diverse and Canadians that are coming up through the systems, but there are also mentors who recognize the need for that diversity. And to me, that's hope.
Yeah, no, honestly, like you just giving kids the hope that they can see someone who doesn't look like all the other past prime ministers or all the other past MPs is such a huge thing. Like I remember when I was younger, my parents never put me in French immersion. And one of the things that my mom used to say was that it's not like my kid's going to grow up and be prime minister. And I remember that when I got a job in the federal service, and I was like, man, if I knew French, it would be so much easier for me. And
Yes.
I just remember that being such a casual thought and such a normal thing, where my parents wouldn't even imagine someone that looks like me or someone who is their child even having the potential to run. So it's very like motivating for you to like be able to run.
Yeah, thank you. And that resonates very much with me too. When I was young, my parents also said, French, forget about it. And it didn't hurt. It didn't help that a lot of my French teachers weren't that great. But I've also reflected on that, which is immigrants to this country not only have a barrier with English, but then there's actually also, especially when it comes to our institutional and government and federal systems, an opportunity barrier if you don't speak French. And so now there's like almost two barriers that you have to get through to get on level playing field with other whites, potentially bilingual Canadians. And I can say this because my fiance is a white Canadian who is completely bilingual. Her family is from Quebec. And I know, you know, I can see the difference in the sense of the opportunity and the ease with which it was never a question that she would be bilingual, and I don't think she recognizes what an advantage that is in Canada, in our society. Whereas for immigrants or for racialized Canadians, they don't even know that that's an advantage. So no, I completely agree with you.
Thank you very much, Phil, for sharing such an inspiring story. I think we can all agree that it's gonna, you know, inspire many of our listeners to achieve a political career if that's one of their goals, for sure. On that note, we want to thank all our listeners for tuning into this event. We hope that this helps you make more informed voting decisions with this upcoming election day. Please make sure to stay up to date with the PHYAC for future events like this. And also, we'd also want to give a big thank you to Phil for being with us today and for dedicating his time. We really appreciate it, and it's been a pleasure having you here. If you'd like to know more about him and his platform, please do check out his social media and his website. And we hope you all have a wonderful evening.
Thank you. Thank you so much. And before we go, can I get a picture?
Yes, for sure.
Okay, great.
Sure.
I'm going to count down from 3 and I'll just have everyone smile. Okay. 3, 2, 1, smile. Awesome. Thank you so much.
Thank you.
Our social media account too, if you don't mind.
Sure.
Perfect. Okay. 3, 2, and 1. Perfect.
Oh, nice. Yours has a little click sound to it too. That's great. Well, thank you so much. You know, thank you for inviting me. It really is an honor to be able to do this and to share my message. One of the most difficult things of running an election during the pandemic is reaching people, and so it's really important that and I think this is true. Every member of parliament, their number one job is to connect with their constituents, to hear what they have to say, and to engage in conversation. And I've just been really grateful for the opportunity to do that in any forum, in any way.
Awesome. Thank you so much. And I'll let you know when the recording is posted up on our social media channels as well.
Okay, great. Have a wonderful rest of your Monday.
Have a good evening.
You too. Take care.
Bye.